Welcome back to Living 757. Ashley, April is Melanoma Awareness Month. And today we're going to talk about things that can save your life and also a lot of education for the people that doesn't know how to do screening yourself, you know? And for that, we need our expert. Let's welcome Dr. Theresa Talens. How are you?
Hi, I'm doing well. Thanks for having me.
Yes, welcome to the show. You're dermatologist, nurse practitioner, and doctor of nurse practice.
Yes, thank you for clarifying.
Yes. I was like, let me read that one.
So
And
many
doctor
titles.
of nurse practice. I
You gotta
love
say
it.
well.
Yes,
Yes.
so dermatology nurse practitioner. Yes, ma'am.
And a doctor, yes. Well, welcome to have here at Living 757. Now, we're going to talk about a topic that maybe some people don't want to talk sometimes, you know, especially when April is Awareness Month, but I think everybody should be knowledge and just check this all year long, right?
Yes.
So let's talk about melanoma, skin cancer.
Yes. Yeah, so melanoma, May is melanoma.
May, sorry.
That's okay. So melanoma is, May is Melanoma Awareness Month. So this is a great month to bring awareness to the community that melanoma is the #1 skin cancer that is responsible for skin cancer deaths. And skin cancer in general is the #1 cancer diagnosed in the U.S. So thank you for having me and just bringing awareness to this topic. So basically melanoma, you know, it's one of those things that you may not know that you have. And I think what we're going to bring to your show today is full body skin exams and understanding the importance of getting at least an annual skin cancer screening for prevention.
Yes.
Now, so melanoma is something that runs in my family. My mom, my uncle, like mostly my mom's side. But for me, I've always been like, oh, I have too many dots. So yeah, so I have gotten them checked several times and they're always like, these are all benign.
Yeah.
Like that's just what happens sometimes.
Yes.
So how do you kind of know the difference between benign and not?
Yes, so there is an acronym that we go by. It's the ABCDEs of melanoma. I hope we can kind of bring a picture of what it is.
Yeah, we see it right
Yeah, so typically what we want, so if you can get a visual of what your moles to look like, typically we want our moles to be nice and round, less than a pencil-sized eraser. We want it to be one color, nice and circumscribed, and not changing. So ABCDEs of melanoma are the red flags that you're looking for. So me as a provider, when you're coming in, what I'm looking for are your family of moles. How are you typically growing your moles? Is there one in particular that's standing out? So that's called the ugly duckling sign.
Yes, I call it the body. They have body.
Yeah.
Like you can touch them because you can see that I have one mole here, but I call it huge, like flat, huge. I don't know if that's the proper name.
But those are questions that we would ask,
Yes.
you know? So the along with the ABCDEs of melanoma, those are the red flags. So if it's asymmetrical, if B, if the borders are jagged, if C is color, if you have different colors within your mole, D is diameter, if it's bigger than a pencil eraser, and E is evolution, is evolving. So along with what I can clinically see.
So let's do with Ashley. Like, you can do like a screening and just walk us through.
And she's a perfect high-risk patient because she's fair-skinned.
Yeah.
She's got blonde hair and she's got blue eyes, so very at risk for getting burnt. So she's a perfect, and typically when the skin cancer, I don't know how old you are, but you look quite young.
Oh, thank you.
Typically,
she's the baby.
The skin cancers start by 40, and it's from cumulative sun damage in your younger years. So it starts, you know, so what I'm going to look for are all her moles. So again, I'm getting a general overlook. So she was
you will call these moles, right? Like
yeah, so these are moles. So I'm just looking at her body and I'm just overall getting a general look. So first I ask a patient, is there any particular mole that you notice that has changed, getting bigger, or any of the ABCDEs we talked about? Is there any particular mole that you have in mind that's been bleeding, burning, itching, that's been changing that you've noticed?
I don't think so, no.
And then the second question I would ask, are you aware of what to look for, and do you look at your moles?
Yeah.
I do, but I have so many that I...
Okay.
Yeah, I honestly...
It's hard to keep track.
It is.
Okay, but nothing, because most times when patients see me, they're like, this mole is the one that's been bothering me. But is there any in particular that has been bothering you?
So, not recently, but when I was pregnant with my son, there was one that started bothering me. Like, I woke up one morning and it was itching, and I went, and I panicked, and we removed it. It was benign. But
but that's perfect. That's a perfect
I would say
example.
probably maybe look at my back.
Yeah,
'Cause
okay.
that's the
Yeah.
part
Yep.
I can't see.
So again, it's not just one certain, so after I ask the patient, is there one in particular that
Okay.
she is worried about?
Yeah.
I, look at her back and I would look for, the acronym. Is there
yes, I
anything
see.
that's asymmetrical? Is there any borders looking funny? I'm looking at color, I'm looking at texture,
Yeah.
I'm looking at size, I'm asking her, have these evolved, right? So some of them are looking a little bit darker. And that's a
Okay.
good point that you brought up with pregnancy, because pregnancy, your moles will change. Does that mean we got to remove every single mole that grows? Absolutely not. So along with what I can clinically see, is there anything standing out, anything symptomatic? And you can see that all her moles are pretty much one color. There's nothing that really stands out to me.
You do have a lot of moles. I just
know.
noticed now.
She does. She's a perfect patient.
Yeah, she's a perfect patient.
Maybe that one.
Yeah, so this one I would ask, this one looks a little raised.
Yeah.
And so I don't know if we have a
Can you
way
see
to
it?
do
Yes.
a zoom on this.
Yeah, they're doing a
Yeah,
This
I
would
can
be, but this would be an example of, okay, so I would ask her, right?
Yeah.
So the ABCDEs, do you see how it has a little bit of, some irregularity to the borders?
Yeah.
Yes.
Do you see how in
Like
the
a
upper
little
quad, a
dot.
little dark?
like a little
Yeah.
dot.
So it's not, necessarily larger than a pencil eraser, but then I would ask her, is this something that's itching, evolving?
Yeah.
So that would be a discussion that the patient and I would have. Clinically
Okay.
it looks seemingly benign, but the thing about dermatology, it's not black and white.
There's
So-
not a one size fits all.
Right, so then if she was
That is
concerned
cool.
about it and just bringing what my clinical judgment, if I'm not 100%, in dermatology we say if we're not sure, check it out.
Right.
So that's where we would do a biopsy and
Okay.
send it off.
Yep. I'm
And
gonna
we-
call you after this.
and then we just send it off, and just for peace of mind. Sometimes
Yes.
it's nice
So
just
very
to have the peace of
important
mind.
then for people like they discover this kind of mold, so that any changes happen, just first of all, call the physicians, the professionals, and go and check up, right? Because it's very important to be on the top of the game when it comes
Right.
to these things.
And how many
Yes.
people have never been checked?
yeah.
Yes,
A lot.
a lot, and
Yes.
it's so important.
Where can people find you really quick, because time is
Yeah,
running out.
thank you. So my practice is Integrity Skin and Derm Care. It's my sister and I. I'm more on the general derm side, and my sister does the aesthetics too. So those who are interested in the Botox and fillers and weight loss, we also do that. But we accept all insurances, so not only skin cancer prevention, but we also do acne, rashes, Dr. Pimple Popper. I love doing cysts.
Stop it.
Yes. So she's, so I was thankfully trained by a great Mohs surgeon. Shout out to Dr. Brian Johnson.
Nice.
So a lot of procedural dermatology. So not only skin cancer prevention, but
Prevention,
skin
very
surgery
important.
is what we specialize in, and we
Yeah.
accept all major insurances.
Awesome.
Awesome.
Well, thank you so much for being with
Yeah,
us
thanks
today,
for
doctor.
having me.
Yes, because it's very important.
Yes.